make a judgment call. You cannot diagnose Parkinson's by taking a blood sample. You cannot do it by taking an imaging scan. All of these factors play into some calculated decision making, and I will tell you a little bit more about that. So I want to present now two case studies on something that we have done to give you a sense of what I look at it and see how I see this. So here's one problem. The question is this: a doctor, my collaborator, Dr. Kasbekar, is a surgeon. He's a foot surgeon. He was actually at Sassoon Hospital at the time when we did this study, and he came in with this question to me. He says, "Well, I measure a lot of these things, which is what traditionally doctors do. I measure X, Y, Z, and so on of these patients, including the glycated hemoglobin. These are all advanced diabetic foot patients, and I have to make a decision whether or not to amputate the foot. Now, it has to be personalized. I cannot give a blanket answer saying that if such and such and such things are, if it's a diabetic foot, you should be amputating or not. I have to make a decision based on, not I, but the doctor has to make a decision based on all of these things that they've collected, all of these markers that they've collected. How do you use this information in order to make a personalized decision about that particular patient, right? So we did some analytics for them. We used a technology called decision tree algorithm, and here's my answer to that question. It turns out that of about half a dozen or a dozen parameters that were measured in the decision making, it turns out two turned out to be very interesting. One of them is the arterial Doppler scan, and it's basically either absent or monophasic or biphasic or normal or triphasic. There's 5 categories for those. And then ulceration, if it has occurred, the ulcer grade would be important. Here's how I read the decision tree. Here's the decision tree we published. If the arterial Doppler is of a certain type, absent or monophasic, well, then it's very, very likely that amputation is going to take place. If the arterial Doppler is of the other type, though, biphasic, normal, or triphasic, then you have to look at another variable, the ulcer grade. And if the ulcer grade is 0, 1, or 2, or 3, then it's very likely that the amputation is not going to take place. And there's a sort of ambiguous answer if the ulcer grade is 4 and 5. In a percentage of the population, about 20% of the population, you get no amputation, and then it becomes 80% likely to be a case of amputation. The point of this is that decision trees are very useful, and you can get very clear answers. The other point that I want to make about this is that there's a lot of information that was redundant, and we did not use a lot of the other information that is there, that is available to the doctor at the time of making a test. It's these two tests that turn out to be interesting and important. There's a third point that I want to make, and the third point is that it is a combination of tests in certain cases which make the decision. It is not simply looking at that test, yes or no. It is, in this branch, for example, you're looking at, in the left branch, you're making the decision right away, but in the right branch, you're actually using another variable that can then define what the outcome is going to be. And so you're factoring in more than one test in a sense, right? Now, the next example I want to give you is to talk about that Parkinson's disease problem, and I'll give you a very quick run through it. Now, this is a much larger problem. The PPMI has collected, I'll just go straight to, this is just to say that we did give a solution to the PPMI, and our entry was selected among the top 3 solutions to this. Here's the suite of tests that is actually done on these, and you can see it's a huge test. I mean, there's clinical markers going between cognition, behavioral, autonomic, olfaction. I actually, before I did the study, I never thought that olfaction would play a role in Parkinson's, but it does. There's a lot of imaging as well. There's MRI, and there is looking for amyloid plaques and so on and so forth. You do a dopamine screen and so on. It's interesting that dopamine is very strongly related with Parkinson's, but we don't really know how to use that information completely. It plays into the diagnosis, but not by itself. right? There's actually a lot of omics data that's available. There's genetics data, and the alpha-synuclein, for example, is getting a lot of press these days for being closely associated with Parkinson's. There's a lot of blood information, CSF information, that, and beta amyloid again, and urine, and of course, and so on. So this is a panel of, I'd like to stress, more than 500 tests done on these patients. And just to give you a sense of how many people were there in the cohort, well, there's, as I said, there's about 1,000 patients. Of course, this study lasted for about 5 years, and there's a decline in the availability of tests for all of these patients over a period of time. But this portion is considered baseline. That the very first bar is the screening bar. The second bar is the baseline. So it's important to ask this question, whether if you're going to make a decision on whether somebody is Parkinson's or not, typically it takes very long. It can take up to 5 years or so. The question is whether you can decide a patient is Parkinson's or not at baseline, right after their first couple of tests are done. Or you might do a full battery of tests, but you do it early, but you make the diagnosis early. Right, so that's the question. And I remind you that currently there is no answer to this. Right, so there are two types of questions, according to me, in medicine. One, where you know the answer, where the evidence exists. And the other question is, well, the evidence does not exist. Can you use analytics? Can you use data? Can you use the information that is available by examination of other patients to define whether you've got evidence or not? So that you can be more coherent in what that information is saying to you. Right, so what we did, I'll just go quickly through how we look at this problem, and this is just one possible solution. Currently, it's not the implemented solution, but here's one way this is proof of concept that there is a lot of information, and this is one way to look at it. So in the first stage, we do a two-stage prediction. In the first stage, we'd like to be able to predict Parkinson's patients from among other patients, including healthy controls versus there's a group of people called SWEDs, and there's a classification called prodromal, and so on. So we'd like to be able to classify these separately at baseline. This is important to us. We'd like to be able to do the classification early. And in the second, we have to come up with a way of describing the progression of Parkinson's. Remember that there is no diagnosis of Parkinson's, so how would you come up with a way of describing how Parkinson's is progressing? Well, we have to create our own scoring system, if you like, of describing the progression. And then the second part of that problem is, well, not only do we have to come up with a way of describing progression, which is not the consensus model, obviously, but you also have to be able to say whether a patient is going to be in a fast progressing category or a slow progressing category, and you'd like to be able to say that at baseline. So we solved all of these problems, and I'm going to show you quickly what the answers were. So this is my first stage prediction. I used something called XGBoost, a decision algorithm, a boosted decision tree algorithm, for those of you who are interested in that. And you see a confusion matrix. This is the predicted class on the vertical axis. In the actual class on the horizontal axis, the confusion matrix is diagonally heavy, which means that the false positives and false negatives are actually pretty small. We have a very high accuracy of the system. This is 98% or more, and we feel that this actually does very well in identifying PD patients. So I'm going to show you what went in. What are the sort of variable importance? Which are the variables that actually are best predictors of Parkinson's? And the answer actually surprised us a little bit. We thought, some of these cool molecules like alpha-synuclein and so on would actually be indicative of Parkinson's. It turns out for a clinical diagnosis, anyone want to suggest something? What would be the most important thing for clinical diagnosis? It turns out that the current intuition is correct. It is a paper-based assessment. The Hoehn-Yahr stage, the Hoehn and Yahr stage is actually a modified Schwab and England scale. This is a paper-based test which monitors motor dysfunction and so on. And it turns out that that is very highly predictive of Parkinson's. I'm going to skip quickly through the second part of it. I just want to flash these slides in case someone's interested in talking to me more about some of these details. We created a TAP score, total average progression, and we were able to predict whether a person has a high TAP score or a low TAP score from baseline predictions. And again, we got a very good accuracy for predicting about 93% or so for predicting whether this is going to be a fast progressing or a slow progressing Parkinson's cases or an average median progression. And it turns out that, again, a lot of the predictors of the progression turn out to be things like rigidity of the neck, aggressive dreams, that's interesting to us, and so on and so forth. So again, some of the motor characterizations of a patient were very useful. And what I want to highlight here is that we don't yet have a way of integrating genetic data. We don't have a way of integrating CSF or blood data into these analyses. These analyses are actually really clinical diagnosis at the moment. What we'd like to do going forward is to ask if there is any meaningful way of including other parameters like the genetic data, right? And so that's where I feel this is a point of research going forward. So just a quick note to say that deployment of these, because these are machine learning tools, I showed you in the foot amputation case that we had a very clear decision tree. You can look at a chart and say yes, no, this, that, or the other. But these are genuinely difficult to read. They're not human readable, so you have to use a computer to solve them, and you have to have an implementation and so on. But that's not terribly hard to do. So we could implement it on a computer, and and again, ID delivery questions will be very, very important there. How do you deliver these technologies? Okay, so I won't go into the strengths and weaknesses of it. I just simply say that there is a potential for very high predictive capacity for some of these algorithms, at least in the cases that we've shown. There's also a lot of scope for innovation and research in the basic the math of it, so to speak, the algorithms of it. So with that, I'll thank you. These are some of the acknowledgements of the partners who worked with me, and the funding agencies who, or actually, I'd like to thank PPMI and Michael Fox Foundation for sharing their data, which is very important for people like us who don't collect the data ourselves. But I'd like to end quickly with this note, if I may. I think data collection is quite a bit of challenge. ERPs are very useful. They're one way to go to collect data. But I'd like to say, especially to the medical fraternity here, that digitization and collection of medical data, not limited to the ERP, can have very meaningful ways in changing the way medicine is practiced. So thank you all for listening.
Thanks, Pranay. I hope all of you guys got an insight into how much deep this research is and how easy it is for us to sit over there and look at the presentation, and how difficult and the amount of time he spent on the deep research which he's done. I like the decision tree thing and the other part also. And I hope we would have some sessions in the future. For all of you who are students of analytics, business intelligence, and data warehousing, here was a glimpse of the output of that result. So if you are learning those technologies, you have to understand how much long have you got to cover before you actually get into that area. The next session is an interesting session. For all of you who are from Symbiosis, and especially students in healthcare and all Symbiosis students and SICSR and SCIT students who are into technology, just want to mention that we just don't talk technology, we practice technology. And a case study of the use of technology for our students for their healthcare insurance and other needs. Dr. Alka from the Symbiosis Center for Healthcare is over here. And I remember 5 years back, we spoke about the need to use technology to provide insurance coverage to all our students and also for the various other needs. And we narrowed down on paper tracer. And I can tell you that paper tracer is a decision which we don't regret having bought, and that can be best explained by Linda. Linda is the CEO of Paper Tracer since August 2014. She started off as the CEO in 2011. Prior to joining the Paper Tracer team, Linda has held various executive positions in large healthcare systems in Eastern North Carolina. She's got 30 years of experience, including executive leadership, operations, process management, business development, and enterprise-level system conversions. Linda holds a BS degree in Health Information Management and an MBA from East Carolina University. She's a fellow of American College of Healthcare Executives and Registered Health Information Administrators. She actively serves on community, professional committees, and boards. Linda is going to be providing a case study on Paper Tracer. Please give a big hand to Linda. She's traveled all the way from US to be here with us. The topic of the presentation will be use of Paper Tracer software at Symbiosis, a case study.
Thank you, and I am very excited to be here today and now to listen to everyone else's presentation about the opportunities with information technology and now to really show you what happens when you put technology into action. So I have with me today Raj Varma, who's our Chief Alliance and Strategy Officer, and also Soumya and Tura, who both work very closely with Symbiosis and with the implementation and the use of Paper Tracer. Well, what is Paper Tracer? It's the back-end process. We automate workflows. It is a secure, cloud-based software solution. It integrates paper and digital documents to provide technical and business best practices, automating and customizing these specific workflow needs. And we will show you that as we go through this case study for Symbiosis. How did it start? In 2011, Symbiosis Health recognized that more accurate data was needed to be sent to the national insurance company. And a lot of the errors were due to human errors. The students were entering in their information all on paper forms, so they had to be sent in to the offices. So the administrative staff had to manually rekey or put that information in. There were tons of papers. Think of all those forms coming in, all those files and all those records. So the impact to Symbiosis were that names were often being missed due to human errors. And Symbiosis had to bear those financial coverage for those claims and accidents. The students weren't happy. They said, I've sent my information in, I've done my job, I've sent my forms. There was a reduction in productivity for the staff because they were often searching for information or looking for or trying to resolve errors. There's potential compliance issues leading to potential fines, and there were no reports to support budget planning. The data was not obtainable. It was in manual processes or in multiple locations. So the cost to Symbiosis was a financial cost of operating expenses, cumbersome manual processes, storage needs, lots of files, records, and training. So when someone left, they had to be trained again on those manual processes. As a result, Symbiosis Health chose Paper Tracer because it is a solution that fully automates with compliance checks, streamlines end-to-end with customizable workflows. This graph shows you from the beginning to the end what happens, from preparation to capturing to managing to workflow and us automating those workflows to distributing and routing information to having it securely in one place so you could collaborate all the way in to being able to report off that data. So it's made their processes paperless. It reduces manpower. It's been a cost savings because reduction in printing, better infrastructure, reduction in training needs, and human resources. Security of both the software and deployment is very important to our customers and to us. Paper Tracer uses Microsoft Azure and Peak 10 in the United States to accommodate global business and regulatory compliances with meeting the HIPAA requirements, CFR and FDA regulations, and ISO provisions and requirements. This slide is just an overview of the use. It shows that once data is keyed in through the browser, either by the student, staff, or the doctors, they can interact from any location at any time. Schedules and appointments can be received on their computers and mobiles by the students. Information concerning insurance and claims on data submitted is more timely and accurate. There's paperless because now all the information is in the secure cloud and accessible. And prescriptions can be emailed to students or handed to the student right after they see the physician. And of course, the reports, you'll see that for flexibility of reports, making the data live usable for planning and budget. This slide just shows all of the locations in India that are using paper tracer and how this accessible it is because it is in the cloud, and it also is being used by scope. Having paper tracer as a cloud-based solution, and because it's customizable and flexible, it was easy to scale up and grow use at the 12 locations. You can see they started in 2011 with 5 workflows, added 3 more in 2014, and then in 2016, an additional 3. This increase in workflows also increased their database size from 5 GBs to about 25, and increased users from 30 to 147, with 80 to 90 users in the system concurrently daily. Now, I've showed you that Symbiosis Health has 11 workflows, but I want to deep dive real quick into 3 of those workflows regarding their business uses and values. And this, again, supports all 12 locations, the 30,000 students, and the 54 schools and colleges. First, the health insurance management workflow. It was used to automate the insurance process, customizing it for their specific needs. It starts with the students and staff keying in the information, so it goes directly into paper tracer. The insurance and premium amounts are automatically each day sent in to the NIC. Dashboards are available to check premium totals and number of insured people. The business value has been achieved because the prior process was paper and almost impossible to track and obtain data. And that's due to having 99% accurate data submission, 65% workflow improvement, and 100% improvement in their data budget forecasting. Health record management workflow was designed for outpatient record management. The business use provides complete database for the doctors to see all health records. Students complete their information online using a link, so again, there are no forms. Schedules of appointments are done by email or text on their mobile. Prescriptions can be emailed or printed, and the doctors have easy access to all the medical data. The business value proposition was, again, a 100% improvement without duplications because of direct entry, centralized system with 24/7 access, and 100% for data and budget forecasting. Helps with resource allocation, scheduling, and resource planning, and treatment plans. The medical inventory management was designed to achieve automation of the medicine inventory from purchasing, dispensing, and tracking. The business usage included that the main pharmacy in Pune purchases and dispenses to all the 12 locations their medicines, ordering in advance so they get a best price, and dispensing the right amounts to each location. The locations then enter their quantities, and then alerts are received so they know exactly how much is left in their inventory. Then reports are generated for the executives so they can track medicines dispensed to students and staff. Again, they've had a 30% cost savings due to no last-minute ordering, 100% savings in tracking time, 24/7 access, 100% improvement for data and budget forecast. And recently, the health record management workflow has been integrated with the medicine inventory management workflow for more accurately automating and monitoring these inventory levels. PaperTracer easily allows for development of many reports. And you can see that Symbiosis Health leadership has quickly begun taking advantage of all these customized reports. There are about 38. I'm not going to go through those. But you can see like the medical certificate for up to 3 days. And all of these reports empower Symbiosis Health leadership with information to make their informed decisions using data and makes their offices paperless. Customer satisfaction and feedback is very important to PaperTracer. Each year we do a satisfaction survey. You can see that our overall satisfaction is 4.15 on a scale of 1 to 5, and our customer retention rate is 98%. So this is the proof of, and shows how really our customers use the software. This slide shows the satisfaction rate as PaperTracer has become part of their daily regular business. The ability to make changes, efficiency, flexibility, ease of use, service response, and technical support that's provided, reliability and security. The rating on the average of 4 for 2016 has led to making many more workflows paperless and increasing the use. The ROI is achieved through the business value using PaperTracer. Since the beginning, there's been achieved a great business value and with these benefits on the average of a score of a 4, reducing errors, reducing workload, saving time, automating processes, coordination of all information, and reducing calls because the information is in one location. As they continue to increase their use, they recognize its business value even further. The top 3 features providing most efficiency. This shows that how Symbiosis Health empowered and led the way to become paperless over the last 6 years. Record management, as of today, 100% paperless because all the healthcare-related data is in PaperTracer. File management, as you saw before, the data storage increases from 5 GBs to almost 25, meaning all papers continue to go away and data is electronically saved in PaperTracer. For report generation, we share with you all those many reports they're using for their staff and students and how it helps with planning and budgeting. Before PaperTracer, they had everything on paper. Again, it was cumbersome and not possible to have really good data, and now the electronic data gives them ability to do better planning and resource allocation. So what we ask is on the survey, before PaperTracer, what did you do? Well, it was quick and easy answers. Everything was on paper. It's excessive manual processes, a lot of manpower, a lot of storage, and the issues included miscommunications between departments and students, missing information and errors, and unfiled insurance claims. After PaperTracer, fully paperless. Direct data entry from all the medical staff and the students, creating automated processes, reducing administrative responsibilities and errors and risk, allowing more emphasis to provide better health care and improve student satisfaction due to better claims handling. With the information in one place and automation, it resolved the paper issues. Centralized information is now searchable. Alerts were being received from your staff and students, automatic daily reports, automatic information to the insurance providers. It provided a clear-cut system that all could understand and work within, allowing Symbiosis Health to focus on providing better healthcare services. So now we have a 1-minute presentation.
Since 2011. The thought process was that in consonance with the national agenda of deploying technology or delivering IT-enabled healthcare services, we adopted this PaperTracer software in 2011. Obviously, we are a satisfied client. There's a reduction in the workload of the doctors, reduction in the time they spend in work such as making phone calls, issuing certificates, scheduling health checkup, so on and so forth. And all the inherent advantages of deployment of technology come inherent to the use of paper tracer. And I would therefore strongly recommend that such technology-enabled, IT-enabled healthcare services be deployed by all service providers, more so in educational institutes which have a large volume of student database or faculty database, which reduces technical errors, saves on manpower costs, and overall improves the client satisfaction index at these establishments.
Good morning. I'm a consultant with Symbiosis Center of Healthcare. I've been using paper tracer software since the year 2011. I feel that the paper tracer software is a good tool to maintain a comprehensive medical data of all my patients. It is easy to use, easily accessible. It becomes easy to share data with other medical consultants. I use paper tracer software to send out medical prescriptions, feedback.
The physicians who use the paper tracer on a daily basis. Paper tracer, though, provides the foundation, but it takes good leadership and great leadership to make changes happen. Symbiosis Health has been proactive with having good healthcare services, have driven to automate their processes, improve efficiencies, and have accurate information. All of this achieving cost savings. Symbiosis Center of Healthcare is definitely a role model for being paperless, improving student satisfaction, reducing risk and errors, improving processes, and having the information in one place that's accessible by all the physicians. So we're very honored to be a partner of Symbiosis Center of Healthcare as our flagship site in India. Briefly, this is our team. We come with many years, probably about 100 years of experience in total, and have a lot of experience with the programming, with IT, and implementation of such systems. This is a list of our current customers. You can see many of our customers have been with us for many years. They always, most of the time, started out with one or two workflows, and now in the enterprise level, some of those organizations have as many as 40 workflows and over 500 users. And then thank you for your time. Again, we're very excited to be here and very excited to be part of this panel and tell you what differences information technology can make in providing services. And I also have with me, again, Raj and Samaya, who can help answer questions and answer more details because they work so closely with Symbiosis Health. And we'll be glad to talk to you after the session as well. Thank you.
Thanks, Linda. That was an interesting session, and we're proud to be your partners too. The last session of the day, and not of the day, of this particular track, we would be, how many of you use software, operating systems, Windows or whatever? All of you use software, right? You find the cost prohibitive? Do you find the Windows operating system cost very prohibitive? Oh, no one wants to talk about it. I know the reason why. Okay, I assume that, yes, costs are prohibitive, and at SICSR, the institute which I head, we promote the use of open source software, and we also have one of Asia's biggest open source technology festival, which is called as Gnanify. And if you guys want to learn technology, and admission is free, no registration charges for Gnanify, you're welcome to SICSR. The next topic, which will be spoken by Pankaj Kanchankar, who's a co-founder and commercial director at Satvix Informatics, is on open source software. Pankaj is going to be talking on open source technologies in healthcare. Yeah, just want you to understand that this session is trying to showcase that you need not always pay for software. You also have open source technologies, and that's what Pankaj is going to be talking about. Pankaj Kanchankar is co-founder and commercial director at Satvix Informatics. He is involved in healthcare and open source solutions for the last 5+ years. Pankaj comes with 17 years of industry experience in technology. Prior to founding Satvix, he was working with ThoughtWorks, a progressive multinational software consulting company. At ThoughtWorks, he was instrumental in development of Bamini, an open source electronic medical record solution, an EMR solution. In last 3 years, he spearheaded the implementation of Bamini in rural Maharashtra at Search, Gadecholi, and Lok Biradri Prakalp Hemalkasa. These are locations in India. At Satvix, Pankaj is responsible for identifying and enabling hospitals and NGOs in healthcare. He works closely with various stakeholders to identify issues on the ground and propose technology and process consulting solutions. Over to you, Pankaj. Just a